the weapon we can use to treat such a difficult chronic wound. Multimodality treatment and approach such as the local debridement, and also we can offloading of the pressure, and also we can put a negative wound therapy, and also we can treat systemic use antibiotics, nutrition support, and also vascular intervention, even bypass surgery or hyperbaric oxygen therapy. However, till now, even we have a lot of strategies we can approach. What is the optimal approach enhancing diabetic wound healing? Should be still not good enough in our medical practice. So without tracing back the history and the patient background, you can look at one is the major issue is the low oxygen suppress the tissue healing, and hypoxia inhibit the tissue healing. They decrease the collagen the synthesis, and also sustain the angiogenesis, and also the bacteria target cellular release oxygen the species and epithelialization. So in our classification regular with treatment management, we in the past we use a time scale, use a tissue management, infection, and moisture on epithelial advancement. However, that's the most recently very focused in the oxygen balance and in this field. And also from the international working group, IWGDF, they mentioned they use a PADIS classification. During that, compare with the PADIS and moist treatment grading. The most important, as we mentioned, the perfusion actually is the most important for us. So how to increase the perfusion? One is the invasive treatment, such we can do the endovascular intervention as a bypass surgery or endovascular intervention. And such as this patient has got a diabetic fat ulcer and that's PLD, very low ABI index. After we do the angioplasty endovascular intervention, and then we wound care and sacrostomy, and final, we approach use the free flap to cover the defect, also combine skin graft, and the final we can salvage the limb. And so, however, in the patient, the relative always in their diabetic foot is that hyperbaric oxygen or topical oxygen or the use of other gas compared to standard care is more effective for achieving a wound. So as we know that providing the oxygen balance, and you can find that's the fields, and we can use the hyperbaric oxygen. We use the pressure delivery, or use the continuous delivery oxygen, or even we can use the oxygen diffusion enhancer. So, such as this patient, we also a diabetic foot ulcer and severe PLD. We after arterial intervention angioplasty first, and he received the toe amputation because there's a gangrene change, and we gave antibiotics, and then he received the hyperbaric oxygen therapy combined hydrochloration, and after around the 3 months, the wound complete here. And we tracing back the history and do the systemic review, we find it actually hyperbaric oxygen therapy that can enhance oxygen wound healing in severe diabetic foot ulcer. However, we do more analysis. We find that hyperbaric oxygen therapy actually could decrease the major limb amputation. However, there are no positive effect to decrease the minor amputation, such as toe or metatarsal region area. So from the international working group, they mention has HBOT Hansen wound healing in diabetic foot ulcer. Actually, they still need to the fuller blinded or random trial study, and also reconfirm the cost-effective that we define to has a benefit from the patient receive the hyperbaric oxygen therapy. How about the topical oxygen therapy? The topical oxygen therapy actually they provide more practical for patient-friendly mode of delivery oxygen. The most popular common use in NATROS oxygen therapy machine that can continue diffuse the oxygen and deliver system device and diffuse a very low constant flow of pure oxygen. However, from the systemic review, we find that the data is support if the patient has a Wagner classification grade 1 and grade 2 diabetic foot ulcer, they could enhance the wound healing and in patient with the absence of infection or ischemia. So that's the result mentioned. That's the wound healing at 3 months follow-up. They compare with standard treatment. There's significant improvement with the TOT. However, from the meta-analysis to review, even that the topical oxygen therapy could increase the diabetic foot ulcer, they still need to adequate power to test effective treatment or amputation in treatment ischemia ulcer, and also cost-effective still need to more study. And how about the adjuvant therapy with the oxygen enhancer? That's the hemoglobin spray. Topical hemoglobin has been demonstrated could be effective topical oxygen therapy, and it could rapidly increase oxygen therapy concentration level in wound tissue. And that's the one company mentioned use the Greenlux. They actually is a porcine topical sterilized hemoglobin spray for treatment of non-healing wounds. And that's the mechanism is to diffuse the spray, the hemoglobin in the wound region area, and then the oxygen is available to the surface and diffuse the wound bed and can deliver the oxygen gradient through the hemoglobin and to the topical tissue. And that's a spray directly from the wound after debridement. And as the past study, they mentioned as compare with the standard care and standard care with the Greenlux treatment, you can have a spray, find significantly enhance the wound healing as a control group. So I tried to get some pilot study for this study as apply the topical hemoglobin spray, such as this gentleman that have that's a female that have a severe diabetic ulcer. They have uremia, diabetic, hypertension, ischemia heart disease. So you look at a very low ABI index. After that, we do the angioplasty first, and then we start to apply the Greenlux for 2 months after that, and also combination with debridement. Then finally, we put a skin graft and surrounding tissue. We can look at complete here. And another big case also, that's a gentleman has a 57-year-old, they're diabetics, ischemia heart, and also look at the toe, they have problem and ulcer and anterior wound. You can look at that very severe arterial occlusion in that tissue area. So we do the arterial intervention first. After that, we apply the Greenlux topically after angioplasty. You can find 2 weeks, there has some granulation tissue grow up. And then finally, we can just put the 4 week and finally put skin graft, and the wound can complete here. And the other case also, that's severe in the plantar area, and infection control first. That's we do start to use the Granulax spray in the surrounding tissue area. And then finally combine what you can look at some granulation tissue they start to grow in. And then we also combine the alternate collagen together and put final. Then the patient just receives the skin graft, and then when healing gradually, and you can look at after more than 10 to 8 months, they complete here. And another severe case also, they have foot ulcer, severe PLD, and after debridement, the infection, sterilitis occurred, necrotizing fasciitis extended after angioplasty. So we control the infection first. We need to extend it, fasciotomy, and the infection control. And final, some toes still not good, we do amputate it. We combine the MPWT first, and then we start to use the hemoglobin spray. And you look at us, the final, just 2 months treatment, and you look at the progress in the wound. They slowly progress after just topical hemoglobin spray, and the patient rejects the fuller skin graft. So we continue use the hemoglobin spray, and the final, the wound complete here. So from the concept, the moist actually compare in some ischemia tissue. That's a quite important supply the oxygen therapy. And oxygen therapy actually is recommended as a adjunct therapy for ischemia diabetic foot ulcer that fail to heal after 4 to 6 weeks of standard treatment. And we can use systemic hyperbaric oxygen therapy, topical oxygen therapy, and also we can use the hemoglobin spray such as Granulax, could be suitable for poor healing wound that fail significant improvement. However, we still need to future for the more larger clinical trial evidence and what is the timing to approach this procedure. Thank you for your attention.